Access Care Compliance supports over 19,000 care professionals across the UK in meeting their compliance needs. From residential care homes in Manchester to domiciliary care services in Edinburgh, our platform ensures every organisation stays compliant with regulations and much more. Registered managers need real-time insights to drive improvement, but most data sits locked in static reports. Simple questions become time-consuming searches, so they stop asking. When inspectors arrive, proving strong performance without instant data access becomes a nightmare. Poor preparation leads to failed inspection costing hundreds of thousands. Without systematic prompts, teams drift back to old habits. Access Care Compliance solves this. Instant insights, real-time answers, automated workflows that keep you ahead, transform reactive chaos into proactive control. What if you could finally get ahead of compliance instead of constantly catching up? Meet Evo Copilot and Feed, your AI-powered care compliance assistant designed specifically for care organisation. Copilot lets you ask questions in plain English and get immediate answers from your live data. Feed keeps you informed about what matters most before problems become crises. Instead of spending hours analysing data, simply ask Copilot, what are the most common incidents this year? In seconds, Evo processes thousands of records and gives you exactly what you need to know. This isn't just data, it's actionable intelligence that helps you deliver better care. Which locations have the highest number of complaints? Access Evo can find this for you in seconds. Access Evo is available on desktop and mobile, so your entire team has instant access to insights. Evo Feed transforms reactive management into proactive compliance management. See how it automatically flags incidents, overdue audits, and compliance issues? These aren't just notifications, they're your early warning system. Smart prioritization means you see what matters most first. No more hunting for problems, the system brings critical information directly to your attention.
Welcome to Access Care Compliance. This video will take you through the 5 key things you should know about our compliance and governance solution. Regardless of type and size of service, the system can help you digitise your manual and time-consuming processes so you can spend more time actually delivering on your service improvement plans. First up, let's look at the dashboard tracker. Whether you have just one or multiple registered locations, the easy-to-use dashboard allows you to keep on top of your regulatory position, broken down by rating and domain, track audits, see any trends in identified non-compliance, and monitor your action plans. Next up is the audit library. We'll provide you with a standard library of audits that have been built with customers and our in-house compliance expert. The library of audits covers domiciliary care, residential and nursing care, and also supported living, so there are audits for each provider type within the sector. Audits can be edited to make them personalised to the service or created from scratch, and each audit is given an audit schedule to ensure that they're being completed on time. Let's see how the audits work. The audits are generally a series of questions that prompt users to take action if they identify any non-compliance or find a concern. For each question, the user should include some narrative and upload evidence to support their findings. Audits can be designed so that as the user answers the questions, they're told whether action must be taken. Based on our responses, the system may provide suggested actions, or we can create our own. Once all actions have been created and we've entered some summary comments, an audit report is created which can be exported to PDF. Actions may be created whenever an opportunity to improve is found. This typically will be following an audit, but may also follow a complaint or incident, or an external audit from perhaps the local authority or the regulator. Actions are always linked back to the origin, so for example, we could check that all actions following an inspection have been appropriately actioned and chase them up if not. When completing an action, the owner is expected to include notes around what has been done and evidence this by uploading documents. Upon completing the action, this then hands over to another colleague for validation. This ensures that even if delegating actions in care compliance, management can still confirm that things are being done to a sufficient standard. If anything was missing, the validator may choose to push the action back to in progress to be revisited. Following changes to the CQC assessment framework, the mock inspection tool for care compliance has been redeveloped to allow customers to evaluate themselves against the new quality statements. So why do a mock inspection? It's to see how your service is doing against the quality statements within the 5 key questions. You can upload your evidence and, where needed, create relevant actions to improve your service's evidence to achieve the rating you deserve and aspire to achieve, and to get recognition of the great work your team are doing. When conducting a mock inspection, we first go through initial questions. It's the information the CQC are looking for, things like insurance certificates and whether you display your current rating in the correct places. If selecting no at any point, we should create an action. Once we've completed that, we can look at the 5 key questions. And within SAFE, we have 8 quality statements that will enable you to think and map your evidence in the way that CQC will be evaluating you. Each quality statement is split into evidence categories, where we'll provide a rationale for our responses and start uploading our evidence. If required, we can link evidence that we've already uploaded for a previous quality statement or evidence category. If we find a gap in our evidence, we'll create an action, which is automatically linked back to that quality statement. For each statement, we provide a level of assurance, which mirrors the inspection ratings of inadequate to outstanding. Returning to the summary screen, within here we can review our action plan for this inspection, checking how actions are progressing. We can refer to our evidence list, where we've clearly defined the quality statements that each piece of evidence relates to, enabling us to walk CQC through all our evidence efficiently. Once we have completed all key questions, we can view the completed report. This report is similar to the CQC report format and will include your rationale for each quality statement, along with the action plan from this mock inspection. Any actions captured during the mock inspection will form part of this report, and the report is updated once the action is completed, demonstrating that issues found are followed up. The actions are also added to your service improvement plan and will appear on your dashboard until they are completed. As with most software systems, the main benefit of managing compliance in this way is reporting and being able to pick out trends and compare our services. Dashboards show data relevant to the user, so a quality director would have full oversight across all their services, whereas a registered manager would just see the service they are responsible for. The Action Plan Monitor allows you to see all actions that are in progress, along with the service and category they relate to. By summarising this by type, you can easily pick out trends across the business. In this example, there seems to be a significant issue across the care files. Clicking the bar, you can see that this affects multiple services rather than just one, so may prompt additional action. Without this kind of oversight, there may be multiple services trying to make improvements when a more systematic change is needed. In summary, our solution will allow you to demonstrate good governance and that your services truly are safe, caring, effective, responsive, and well led. Thank you for watching. We'd love to hear from you.